Hi, welcome. I'm Dr. Khaled Sadek, and you've joined in for another episode of my virtual clinic, Global Virtual Clinic. For those of you who are new to the channel, I'm Dr. Khaled Sadek, and I specialize in the removal of cysts and lipomas. And I've dedicated my channel to showcasing how easy it is to remove such deforming and disfiguring skin lesions. So if you're looking to have medical treatment for the removal of anything you've seen on my channel, then please don't hesitate to contact me at lipomacyst.com. You can also find me on Instagram, Twitter, and Facebook. And you can also find more information at drkhaledsadek.com. Remember, we run our virtual clinics every Wednesdays, Fridays, and Sunday, where we give free medical advice to those who are watching. We take questions from all over the world, as well as discussing some of our new released videos and some of the old ones as well. So with no further ado, let me welcome everybody for joining. So today we did a little bit of a shake-up. We released the video ahead of the live chat. So we typically normally have the live chat, the virtual clinic, and then we go ahead and release the video. But today I thought, let's try something new. So for those of you who have seen the video, you are welcome. For those who are yet to see the video, don't watch it straight away. Watch it after the virtual clinic. I think going forward, we'll probably always run the video after the virtual clinic. In last week's episode, we discussed thyroid disease, and that seemed to be a very sensitive topic with a lot of our viewers. We know that thyroid disease is more common in females, especially around middle age. So it was wonderful to hear so many great experiences that people have had fighting thyroid disorders, thyroid cancers, and recovering with good medical treatments. If you want a recap on the thyroid video, then don't hesitate to go and watch the thyroid video on my YouTube channel. But in summary, we discussed hyperthyroid, which is an overactive thyroid. We discussed hypothyroid, which is an underactive thyroid, and the common causes, such as Hashimoto's or Graves' disease, which are autoimmune conditions. One results in the overproduction of thyroxine, and the other one results in the destruction of the thyroid. We covered the common hormones of thyroid disease, such as thyroid stimulating hormone, that comes from the symptoms associated with thyroid disease, in particular, mood changes, weight gain, weight loss, irritability, heat and cold intolerance, bone thinning, and hair loss. So which tied in quite nicely with one of our previous videos where we talked about osteoporosis and osteopenia. And if you do recall, that one of the conditions that we mentioned that can result in brittle bone disease is a thyroid disorder. So there we go. So in this couple of episodes, in the last episode, we released an absolute whopping great big epidermoid cyst, a pilus cyst in the scalp. It'd been there for so long that it actually eaten away the skull. So there's actually sort of an indent in the skull where the pilus cyst had managed to kind of erode the top there. So my advice for anyone who's watching and a little bit hesitant about getting the surgery, well, look, get it done sooner or later, because that is a complication. We're going to struggle to sort of pat that out. So if you catch it nice and early, we can put the skin back together and there shouldn't be a little dent inside the skull. If you haven't seen that video, make sure you check it. It was one of my favorites. I really like it. So make sure you check it out as well. On Sunday, we're going to move to a massive facial cyst right there on the cheek. And this one's really exciting because for the first time, we took it out and we found literally yarns of hair. Like there were strings and strings of hair inside the actual epidermoid cyst. At one point, I actually thought maybe it was like surgical stitching from the previous case. So make sure you join me at 9:30 Greenwich Mean Time, 1:30 Pacific Time, 4:30 Eastern Time, and we'll go through that together. That's a really good video, so make sure you tune in for that. We've also had some rather gory stuff come in, and I know that the gories are particularly delicate on the stomach, but if you want to see some gory videos, let me know. Maybe we'll have that behind a membership. I don't know. We'll see. It's not for everybody's cup of tea. So listen, let's do a shout out. Remember, if you've got questions for me for the live chat, for the virtual clinic, then please do Ask away. Happy to cover any medical condition as much as I can. We did say that we're going to talk about gut disease, Crohn's and ulcerative colitis. We can talk about common bowel symptoms like irritable bowel syndrome. We've got a bit more time because we don't have a video to run to. So let's start by saying hello to everybody, and let's see who we've got in store. Remember, as a warm-up, we like to go right to the very top and give our podium positions. 1, 2, 3. For those 3 who are in at number top 3, but don't worry, if you didn't get the top 3, we still give you a shout out. However, we won't give a shout out if you don't hit the like, and I know which of you have hit the like and which of you haven't hit the like. So hit the like if you haven't hit the like already. Right, let's scroll up to the very, 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 very top. So in at number 3, we've got Gibby's wife. Welcome, Gibby's wife. She joined us on the premiere for the last episode. Sherry from Virginia, welcome, Sherry. Sherry's been doing great work. She's been identifying channels which have been ripping off our videos, passing them off as their own. So we've been flagging those up to YouTube. And in at number 1, we've got Alessandra. Alessandra, welcome. How are you doing? Actually, it's Sherry's number 1, Alessandra's number 2. So we've got a bit of America, we've got Brazil, all in on the podium position right there. So Gibby just caught the last few minutes of the last video. Yeah, so I was just trialing that because what I've noticed was some of the bigger channels, some of the bigger popaholic channels were kind of timing their videos according to when the little channels were releasing their videos. And by doing that was kind of skewing the way YouTube shares the viewership. So I thought I would just try and do some step work there and see how it has affected. But actually, I think it's better if we just continue as we are, and we just take the bombs as they come. Lisa, welcome. Lisa Gianturco, how are you doing? Marion, how are you doing? She's safe and well and hoping everyone is too. Let's have a look what we've got here. Marion is not long home from dialysis, so we're wishing her all a speedy and youthful and energetic evening. Let's have a look what we've got here. Scrolling up, we've got Gail Sharp, ready and waiting to learn something today from East Texas. Awesome, awesome. And Sherry, do you have any recipes willing to share? We've got Bridget Schumacher is in the house. Welcome. Andrea Uberhorst, welcome. Let's have a look. Scrolling through, Belinda from Germany. Belinda's been doing some amazing work with Instagram. If you're on Instagram, you'll know what I mean because you've seen her videos in my storyline. But she's really kind of taking the essence of the videos and really making it marketable, which is amazing. You should be doing that permanently. So yeah, so if you like those kind of things, check it out on Instagram. They're in the stories. I think you click on my face and it comes out and you can see Belinda's work. Really awesome stuff. Took a vacation day to spend it all with you. Welcome back, Gibby. Greetings from Germany. That's Andrea Ubenhorst. Welcome. Let's scroll through. Margaret Brace, good evening, doctor. Kindly speak about excoriation disease, so itching diseases. Okay, that's interesting. I mean, they're so wide and varied. I mean, itching can be all skin conditions have an element of itching. You know, whether it's eczema or fungal or psoriasis, there's always an element of itching. So, you know, there's diseases of the skin that can cause excoriation, and there are also, you know, not just things that can go wrong with the skin, but things can go onto the skin. So, you know, like scabies and parasites and mosquito bites, these can all cause itching because of the histamine reaction. And then there's all elements that run through your bloodstream that can cause itching. And most common of all is bile. If bile acid gets into your blood, it's very, very itchy. And you see that most of all in pregnancy. In pregnancy, they get obstetric cholestasis, which is a very itchy condition. So that's a little brief overview of itching. When we get going, my husband can walk in and say, so you're at it again, live chat, woohoo, welcome Lisa. I've already been informed my sister that the doctor will be in the house at 4:30 and not to disturb me. That's Sherry and her sister. They've got an arrangement to not to be disturbed. Well, look, get your sister involved. Get her to have a look. House calls demand Bridget Schumacher. Hi, everybody. That's Anne Brooks. She's welcoming everybody a wonderful evening. Welcome. Let's have a look what else we have here. Need to know about diverticular disease. Basically, outpouchings on the colon. So if you can imagine the colon, the large intestine being this like tube that runs from the right side of your pelvis, and it goes all the way up and comes down to the left side and into the rectum. So you've got this like U-shaped upside down N. Now, when we pass stools, when we defecate, we kind of increase the abdominal pressure so that the stools pass. By increasing that pressure, however, you may develop outpouchings in the colon. So if you can imagine the colon being the inner tube of a tire, and if you put too much pressure in that inner tube, you'll find that the wall just gives way and a little bleb comes up. And that is in effect what diverticular disease is. Diverticular disease is the outpouching of the muscular wall that forms the colon. Diverticulitis is basically an inflammation of the outpouching. So what you tend to get is, fecal matter may get stuck in a localized little bleb, an outpouching, and that causes inflammation. It can cause infection, and in the worst cases, the actual bowel can rupture. So you get, a real surgical emergency. So the best way to make sure that you don't get any diverticulitis if you have diverticulosis, and the way to diagnose diverticulosis is to have a colonoscopy. So that's where a camera is put inside the bowel, and then the gastroenterologist can look for that. You can also have some imaging like barium meals that can also look at that as well. How do we treat diverticulitis? Well, it's antibiotics, most typically metronidazole, which works on bacteria that don't require oxygen. So they're anaerobic bacteria. So the bacteria in the gut, they don't have access to oxygen, unlike the bacteria in the chest. So they need a special kind of antibiotic, and those are antibiotics that work on bacteria that can survive in the absence of oxygen. So metronidazole is usually one. But the way to prevent it is, of course, to make sure that we don't have to really strain. We don't have to increase our abdominal pressure, our tummy pressure, intra-abdominal pressure. And so making sure that the stools are nice and soft. So if you're drinking lots of water, having your fiber, even some laxatives just to help you go regularly. And that way you keep your diverticulitis. So that's a wonderful question, Bridget. Let's have a look. There is music for every occasion, says Lisa. I think it's regarding the surgery. Awesome. Let's have a look. I wonder how many questions he'll get today about the ship. Well, none so far. Let's scroll. Let's have a look. Who do we have? Let's have a look. 115 degrees, says Anne Brooks. Whoa, that's a swelter. That's pretty hot. Let's have a look. Sulalali's in the house. Welcome, Sulalali. Welcome. In the last pop, says Margaret Brace, such a delightful rapport with the client and doctor. Yeah, we had this popaholic couple that came in. Real great chat. Wonderful team. And it was great to have them all in the room and enjoying that. Now, you can see that in the video. So I hope you enjoy that. Dr. Sarah's in the house. Invisalign, our orthodontist, our dentist. All-round superhero is in the house, ready to take your questions on teeth. So any questions on teeth? Kelly, what did you premiere first? I premiered the video that we'd normally do after the virtual clinic first because I wanted to see what happens, just to try it out, mix it up. And from Snaresbrook is the man behind the cam, Prince of Zam. So if you enjoyed the pop in the last video, well, that was filmed by our two camera people. Prince Azam is one. So awesome work there. Awesome work. Tammy Sadler, are we live now? We are sure are. We're sure live right now. Right here, right now. Let's scroll up. Joyce, how are you doing? It's from Lancashire. Welcome. Welcome. It's great to have the UK representing. Edwina Kemp, good morning, doctor, from Australia. Good morning, Australia. It must be very, very early in Australia. And what is your favorite procedure, for the want of a better word? Oh, my favorite procedure. I think I think that all the procedures, the enjoyment I get is being able to take something really, really disfiguring, really, really has plagued the individual, and we take it away from them. People have had these lumps growing on them for years and years and years. And within 5-10 minutes, I try and drag it out as long as I can, but in 5-10 minutes, it's gone, and that burden is gone, and they get that confidence, they get the self-esteem, and really, that is the joy. The joy is being able to take that away from them, whether it's a massive, like lipoma, whether it's a massive cyst, whether it's a wart or a skin tag, whatever it may be, getting rid of that little monkey off their shoulder, getting that weight off, I think is probably the best procedure. I think you'd agree. Let's have a look. Who else do we have in the house? Linda Wiley is saying hi to everyone. Albertina da Costa de Oliveira is saying hi. Hola. Gibby's wife. What about depression? Mental health is a big topic, Gibby's wife. So yeah, I think we're going to have to cover mental health at some point. Not today, but absolutely we will do mental health. I mean, just to touch it briefly, there's so much. I mean, we've spoken about sleep and its role in mental health. We haven't really spoken about the therapies, whether it be talking therapies, cognitive behavioral therapies, whether it be antidepressants. So yeah, I mean, it's a massive topic, and we will cover it absolutely. So let me know your topics and we will cover them. Rosemary Ross, doctor, what's the best way to treat diverticulitis? I think we covered it. I think you're probably reading the comments a little bit slow, but it's going to be antibiotics if it's inflamed. Good evening. Good evening from Germany. That's Andrea. Welcome. Sulalali, welcome. Christine De Viva from New York. Welcome. Princess Am is saying hi. Denise Bond. She's a little bit late, but she's here from Edmond and she's loving it. Enjoyed the cyst. Awesome. Anne Brooks, my eyes are seeping a sticky fluid and leaves hard crystals. I have macular degeneration and dry eyes. What can I use to clean them with? I'm upset with my doctor. Well, look, sticky, crusting eyes, if they're golden, you got to think about a bacterial infection, a Staph aureus. You need to have eye drops. You can get artificial eye drops, which you can put in, and that keeps everything, lubricated and supple. And also cleaning with like a warm cotton, cotton bud with some warm water just to clear away the eye drops. So get your doctor to prescribe. I'm sure he has, but if he hasn't, slap him on the wrist. Let's get that done. Kim Havilon, welcome. Good afternoon, Kim. Lisa Gianturco, welcome. Kelly, sunny Connecticut. Karen Gailey, I like gory, just not lipomas. That's great. Marty, hi from Moreno Valley in California. What is hypoglycemia? How do you treat it? I may have it not yet confirmed. Hypoglycemia, if we break down the words, hypo, we heard that in the last discussion about hypothyroidism. Hypo, that's H-Y-P-O, as opposed to hyper, H-Y-P-E-R. Hypo means a depression, and glycemia means glucose in the blood. So if you get suffering from hypoglycemia, that means your blood sugar levels are low. So we need to work out why your blood sugars are low. It may be you're taking a medication that causes hypoglycemia, like a diabetic drug. Maybe we're skipping breakfast. Maybe we've got a metabolic issue. So that needs to be addressed. So let's see what else we've got. Any more questions? Sulalali, hello, Dr. Sarah. Thanks for all your help with my daughter's teeth. Stay safe. Oh, that's lovely. Becky Goins from North Carolina. Maria Gidley from Minnesota. Awesome. Great turnout. Brenda White from Pittsburgh, Pennsylvania. Let's have a look. Let's scroll up. Sharon Schlebusch from South Africa. Whoa. Tammy Sadler from Kissimmee, Florida. Wow, what a great name, Kissimmee. Alessandro, for me, the schedule for releases is fine. Even when I have classes, I still have time to enjoy the videos in the first minutes or in a break from their work and their studies. But yeah, I mean, why not just break away? Let's scroll up. Let's see what else we got here. We've got Sharon Newby from Florida. Karen Gailey, Humidity. Brenda White from Pittsburgh, Pennsylvania. She's loving the video. Let's have a look. My brother had half of his colon removed and his large intestine recently. Look, Karen, I hope he's making a swift recovery. Let's scroll through, look in the background. Let's see what we've got. Sharon Newby, I'm working with a bad case of dermatitis. Okay, and it's weeping. Yeah, let's scroll up. Any advice on fibromyalgia sufferers? We're going to do a fibromyalgia video. We're going to do an MS video. We're going to do an ME video. So bear that in mind. Maybe we'll do that on Saturday. We'll do maybe do fibromyalgia, ME, and a thyroid update. So Saturday we've got this great big stonking epidermoid cyst. It's got so much hair inside it. I've never seen anything like it. So put it in your diaries for Sunday. Let's have a look. Ohio, Sandra Flynn from Ohio. Let's have a look. Let's scroll through. So many questions. We need someone to kind of answer pull the questions out for us, I think. Sandra Flynn, how you doing? Let's scroll through. I grew Sulalali. Thanks for the information. Awesome. Caroline Tomtom from Wales. Awesome. What are my thoughts on colonic irrigation? I don't really have any thoughts on colonic irrigation. If it works for you, then just go ahead, do it. Joanna A. Dr. Sadek, you and your fans, how are you all this evening? Finding it very interesting watching life-changing lipomas and cysts. Sandra Whitehouse from York, welcome. Probiotics, the benefits for daily gut health, absolutely. Probiotics, really key for that. Let's scroll through. Let's see, we've got Sid G. Try and having some fermented vegetables every day for gut health. So sauerkraut, kimchi, yogurts. Absolutely, definitely. I take antidepressants for depressions and anxiety. That's Kelly. I hope it's working. Tell me more. Marion from Scotland, welcome. Sharon Lesser from North Carolina. Let's scroll through. Marie Christmas, thanks for answering my question about fibromyalgia. I'm watching as usual. Awesome. So many questions, so many great ideas on what we can cover in the next virtual clinics. Everybody wants to know about depression, fibromyalgia. I'm hearing that a lot. Gut disease in one form or another, and the benefits of colonic irrigation. Okay, so look, why don't I leave it with me? We'll do it all on Sunday. We'll piece it together. We've got the fibromyalgia. We'll do the fibromyalgia, depression, and maybe a little bit about gut flora. If you have any more ideas, stick them in the comment section. And if you haven't seen the video that I released before the live chat, then go check that out. Remember, stay as usual Sunday. Bridget Schumacher's put in rheumatoid arthritis. It's a whole topic there, rheumatoid arthritis. I love it. We'll do them all. It seems to be really popular, the global channel, the global clinic. And actually, I think it's really amazing because often the patient-doctor consultation is one-on-one. But what we're doing is we're having a 1 on 70, a 1 on 5,000. And really, that's how it should be. Sending out the information to as many people as possible. So I'll take your questions and you join me again on Sunday, 9:30 Greenwich Mean Time, 1:30 Pacific Time, 4:30 Eastern Time. Till next time, everybody, take care. Ciao. Bye-bye.